Hi, today I'll be performing a head, eye, ears, nose, throat, and neck exam. So I'll get started, wash my hands, come into the room, just do a general assessment of the patient, gather any equipment I might need for this assessment. I would start with the head and the face, so I would just look at the patient's face, make sure everything's symmetrical, no abnormalities, and go ahead and palpate on the skull, just making sure there is no lumps, masses, bumps, anything like that, making sure the hair distribution is even throughout. Go ahead and palpate their temporal artery and then their TMJ, so go ahead and have them open and close their mouth. And also you can go ahead and feel the feel the sinuses, if there's any pressure or pain there, making sure that they let you know. And then I would move on to the eye exam. So I would just take a look at the eyes, making sure they're nice white, no redness, drainage, anything like that. Going ahead and taking a pen light, checking their perla, making sure everything is equal, round, reactive, all that good stuff. And then go ahead and do the distance or peripheral vision test. So standing close to them, having them let you know when they see your fingers, and then also up, down, and then next doing the cardinal test. So I would just have them start in the center, go to the left, up, have them follow my finger down, back to the center, other side, up, down, back to the center, and also just watching, following my finger to their nose, and just making sure there's no redness or anything in their eyes throughout that. And then go ahead and move on to the ears. So I would just inspect the ears, making sure there are no lesions, crust, anything like that, making sure they're nice and pink. You can use the otoscope to assess them, making sure that there's the light reflex, it's a pearly white, no bulges, redness, drainage, anything like that. You could do the whisper test, just occluding one ear, whispering a two-syllable word, and asking them to repeat that word back to you, and then doing the second ear. And then from there, we would move on to the nose. So just inspecting the nose first, making sure it's symmetrical, no lesions, no deformities, anything like that. You can press on their nose, have them look up, use a light to be able to see in there, making sure it's nice, pink, moist, no discharge, no cracks, drainage, anything like that. My patient left. But then you could go ahead and check the mouth. So just making sure that it's nice, moist, no missing teeth, no bleeding gums, anything like that. No lesions. I can have them open their mouth, say ah, checking their uvula, just making sure it is in midline, no facial clefts, no hard or soft palate clefts, anything like that. You could check a gag reflex, have them say ah, stick their tongue out, all that good stuff. And then next, I would go ahead and move on to the neck. So just palpating, making sure it's symmetrical, no masses, no jugular vein distension, anything like that. Making sure that there's pulsations, no swollen lymph nodes. Usually just use 2 to 3 fingers while you're doing that. Checking their thyroid, making sure there's not it's not enlarged, and then their range of motion, having them look up, down, to the side, around, and that is all. So that would be the head, eye, ear, nose, throat exam. Thanks for watching.